doing, Dr. Harris?
Mike, I'm doing all right. How about you?
Good.
It's we meet again, don't we? We've been spending too much time together.
Sir, is that okay? We're fine.
Oh, absolutely. Thank you. Dr. Harris, is it all right if I count you down since we're going to go on the air live? Right?
Absolutely. You tell me. I'm just gonna, and I'll give a. Do you want me to give the call-in instructions before we do that? I guess I could do that now.
You can do it right at the start of yours.
Okay, that's fine. Whatever.
Well, you might want to do it now. Okay. We don't want to put the phone number on there.
Hey, good morning, everybody. We're just about to start in another minute. Just wanted to remind you guys on the call, please make sure you're muted to cut down on the background noise. That's *6 to unmute to ask a question, and then *6 to mute yourself again after you finish speaking. So thanks for joining us, and we'll get started here in just another minute.
About 15 seconds.
Okay, I'm going to unmute here.
All right.
Ready?
Yep.
Okay. Hey, good morning, everybody. Thank you for joining us. This is our regular media update for you all. We have several things we want to cover, and we'll be glad to answer questions for you. Before we dive into the numbers, we need Alabamians to understand that we're in a very difficult position right now. We're seeing case numbers again as high as we have ever seen. We, as of yesterday, have had almost 2,400 people in the hospital. At the rate that we're adding people to our hospitals, will surpass our all-time high from back in January in the next 3 or 4 days. That's put a severe stress on our hospital situation. We have only about 5% of our ICU beds are available statewide. Many facilities, particularly in the southern part of the state, do not have available ICU beds at this time. We are having daily case numbers now that passed over 4,000 new cases reported to us yesterday. We have a positivity rate of around 24%. We lead the country in that unfortunate statistic. We have some counties in the state now that have more than 40% of all their tests returning as positive that are being done. So these are unprecedented numbers for us. It is not likely to go away very quickly, but we do want to remind people that we have a way to prevent this. We need people to be vaccinated as quickly as possible. We have seen an uptick in vaccinations recently. I'll give you those numbers, and that's encouraging, but we still have a long way to go to reach all the people that need to be vaccinated in our state. Young people in particular are not getting vaccinated at a particularly high clip. About under 24% of our 12 to 17-year-old group, our preteen adolescent group, has been vaccinated so far, and as schools come back into session, that's going to be of concern. Remember, kids under age 12 aren't able to be vaccinated at all at this point. We want to remind people that we have 3 vaccines that are safe and effective. We had more data released this week from CDC on the safety of these vaccines, and in particular looked at safety in pregnancy. There is now a very strong recommendation by all public health and medical authorities to vaccinate all people during pregnancy. Pregnancy probably predisposes women to poorer outcomes if they become infected. And so we want to remind them that we have excellent safety data at this point. Those recommendations, which we have been given for some time, have been strengthened. There's no increased rate of miscarriages in people who are pregnant who are vaccinated. There's no evidence whatsoever of any kind of fertility issue at all. There's extensive safety monitoring that's been done with these vaccines in pregnant women, and a few thousand pregnant women that we know of have been studied after being vaccinated. And so we want to remind women who are pregnant or may become pregnant or are just thinking they might someday want to become pregnant, please protect your health and safety. Please protect the health of your unborn child or perhaps your future family by getting vaccinated as soon as you can if you're otherwise eligible. We want to remind people that with Delta virus, we are seeing increased rates of transmission that we have not experienced before. People who are infected with the Delta variant tend to spread this disease to at least 3 or 4 other people, maybe by some measurements, maybe 4 or 5 other people. That's more than twice as infectious as the original variant that we were seeing, and that's a real concern for us. We want to remind people of the importance of masking when you're in indoor public spaces, even if you're vaccinated. We would recommend that you do that. Even though the vaccines are highly effective in preventing infection, there is a certain rate of breakthrough, and when people suffer those breakthrough infections, even though they don't tend to get very sick or to die, they can still spread the disease very effectively. So we are encouraging masking for anyone vaccinated or not in indoor public spaces, as well as our recommendation for universal masking in K-12 schools. I want to begin by going through a few numbers now, or follow up by going through a few numbers now. We are beginning to see some breakthrough cases, as you know. Unfortunately, this is another excuse that sometimes people give for not being vaccinated. They go, well, it's possible to get infected even if you get vaccinated, and that's absolutely true. That's true with all vaccines. However, this is still one of the most highly effective vaccines we know about. It protects probably more than 90% of cases, and certainly even with the Delta variant, more than 80% of cases, probably more than 85% of cases. We have seen since April 1st, when vaccines were widely available and most everyone had a choice to be vaccinated by that point, we've seen a total of 8,700 total breakthrough cases. So that actually represents, let's see, around 10% of the total cases that we've seen since that time. And that's about exactly what we would expect. We understand that there's going to be a certain number of breakthrough cases. However, the percent of fully vaccinated people who have died from COVID since vaccines were widely available in April is 0.001%. The chances of dying after you're vaccinated are extraordinarily uncommon. They have happened, and they tend to have happened in people who are older and have other chronic health problems that otherwise would put them at risk. It's not surprising that we have seen some deaths, but it is so much more likely to become sick, ill, hospitalized, or die if you are an unvaccinated person who gets infected with COVID. We want to remind people that we do have early treatment or even preventative therapy for people before they become particularly ill. We have monoclonal antibodies that are available around the state. We have several dozen locations where those can be obtained, most of those associated with hospitals. If you are a close contact and you're a high-risk person because of age or other medical problems, you may be a candidate to receive a monoclonal antibody treatment. It's an IV infusion or a subcutaneous injection. Your medical provider can help walk you through that. If you're someone who's at high risk because of your age or medical conditions, and you are infected with COVID, and you're mildly or moderately sick but not sick enough to be in the hospital, you are definitely a candidate for monoclonal antibodies, and we want to make sure that you have access to those. So please talk to your doctor about how to do that. For people who develop symptoms, we only have about a 10-day window for you to receive those antibiotics, so don't wait. Please talk to your provider about the possibility of doing that. I want to move on to a few other things. I want to remind people about our isolation and quarantine guidance. We still get a great deal of questions about that. I would say, in short, that guidance has not really changed much, except for people who are vaccinated. If you're someone who's infected with COVID, we want you to go home for a minimum of 10 days. 10 to 14 days is ideal. Please don't return to your public life until your symptoms are improving, until your fever's been gone for at least a day. That's the same recommendation we've had for a year and a half, and that has not changed. For people who are contacts to a case, if you remember our 6:15 rule, within 6 feet for 15 minutes exposed to an active case, again, our guidance has not changed in most cases. We want you to go home and quarantine for 10 days. There's some exceptions where you can quarantine a little bit less time than that, but we want you to go home and quarantine for at least 10 days to make sure you don't develop symptoms. There are a few exceptions to who needs to quarantine, or rather who doesn't need to quarantine. If you have had COVID in the last 90 days, then you're not counted as a close contact if you're exposed to someone else. Or if you're fully vaccinated, you're not counted as a close contact if you're exposed to somebody else. And finally, in the schoolroom setting, if you're at least 3 feet apart and everyone's wearing masks, you're not a close contact if you're exposed to a case. So those are the exceptions. Otherwise, our quarantine and isolation guidelines have not changed. We really need people to understand the importance of quarantining. If someone's exposed to an active case, particularly with the infectiousness of this Delta variant, there's a really good chance that they're going to become infected. So unless you meet one of these exclusion criteria, we need you to go home from the workplace, go home from school, go home from the social functions you normally participate in. Please stay at home for 10 days to make sure that you don't become ill. If you're a high-risk person, we would or even, I'll say not even for high-risk people, if you're a close contact, we would encourage you to consider getting tested 4 or 5 days after you've been exposed, just to see if you could have developed disease. In terms of vaccinations, we've seen an uptick over the past 3 weeks now. We're encouraged by that. We passed 18,000, I think, on this past Friday. Those numbers are still coming in, maybe still bump up a little bit. That's about 3 times what we were doing in June and early July. That's very encouraging. It's still far below where we were in April, in late March, early April, when we sometimes passed 40,000 or even 45,000 doses on a single day. But we are encouraged that people are continuing to get vaccinated. We have vaccines available in over 1,400 locations. Please remember that this is free. There is no charge. You will not be asked to pay for this. For people who have insurance, your provider may ask for information so they can bill an administration fee, but there is no charge for being vaccinated against COVID. We get that question a lot. It's a shame that people haven't quite heard that message, but many people still are worried that they'll have to pay for this in some way, and you will not have to pay for this at all. There is no charge for this vaccine. It's completely free. You can get this vaccine today in every county in Alabama in multiple locations without an appointment. In just about every case, please check our website to see where those locations are, or vaccines.gov. You can put in your zip code and see all the places that are near you based on how far you want to travel, and even which vaccine product you want to get. Remember, Moderna and J&J are for people 18 and up. Pfizer is also available for 12 through 17, so you can search for which location has the product that you want to get, and you can get that today without waiting. We want to encourage people, again, to do it as quickly as possible. Our vaccine numbers need to be a lot higher than they are. If you get vaccinated today, you've got 3 or 4 weeks before you get your second shot in most cases, and then you're going to have a couple of more weeks before you're fully protected. So the actions that you start taking today are great, and yet we're not going to realize the full benefit of those for 6 or 7 weeks, and that's why it's so important to go do that now. Remember, we are just now seeing our deaths begin to climb. Our death numbers have not been in double digits for months, and yet over the past 8 or 9 days, except for weekends where we didn't have full reporting, we've seen deaths reported to us of 35 people in one day, 41 people, 23, 24, 26, 13, and 19, with a weekend where we only had 1 total just because of reporting concerns. But what I need you to remember is that deaths are a lagging indicator. Deaths happen last. We see case numbers go up, we see hospitalizations go up, and then we see deaths go up. So we've had more than a week now of deaths in double digits. This is a snapshot of what was happening 3 or 4 weeks ago, okay? The numbers you're seeing today in deaths are telling us what was happening in Alabama around the 4th of July, okay? It's not what's happening today. So there's no way that these numbers are not going to continue to increase because we're continuing to see these case numbers go up. So please be aware of that. Please do what you can to protect yourself, and please try to get vaccinated as soon as possible. I'll say I have just a couple of other things that we have questions on, and before we get to questions, I just want to remind people, if you've lost your vaccine card, that is something that can be replaced, although it might take a little bit of effort to do that. There certainly is a record of your vaccination if you received it in Alabama in our immunization database. Please contact the person who gave you the shot if you are able to do that. We do not have electronic copies of people's vaccination cards ourselves, so we would ask you to please start with your provider at this point. If that's not an option, then your county health department may be able to provide some other information for you. Ultimately, you can get that vaccine information, but it is a pretty manual process and doesn't happen quickly. So if you've lost your card, please start working on getting that replaced as soon as possible. Let's see. I think that's all the prepared comments I had right now, and I'll be glad to answer questions. We can start here in the room with questions. Yeah, Kim.
Dr. Harris, there's a lot of trepidation and concern with kids coming back to school. What do we know now about how the Delta variant affects children? A lot of people are taking comfort with the idea that original COVID wasn't as rough on children.
Yeah, so the question has to do with the Delta variant and its effect on children. There's a lot of anecdotal evidence. There's a lot of reports that kids are more severely affected. Clearly, kids are being infected in higher numbers. I don't think we're surprised by that because we have a much more infectious variant circulating, and we have older people who are relatively more protected since they are the ones who tend to be vaccinated. We've had, I think the number I saw yesterday was about 39 or 40 kids who were hospitalized around the state with confirmed COVID. There were another 10 or 12 that were suspected to have COVID and were awaiting confirmation. Those are definitely higher numbers than we have seen before. So I think the evidence points to the fact that it is affecting our kids more. Whether that's because it's causing worse disease or whether it's just that there's a lot more cases from a more infectious variant, I'm not positive on that yet. I think, let me ask Karen Landers, Dr. Landers, who's a pediatrician and our health officer, is on the call. Karen, do you have anything to add about the Delta in kids?
Yes, Dr. Harris, thank you so much for asking me to comment. And I just want to reiterate what Dr. Harris has said, and that it appears, at least anecdotally, that we are starting to see more children that are ill from Delta, and again, something that we had not seen quite as much of with the original SARS-CoV-2. And I think another aspect of this is really something that our infectious disease doctors and pediatrics continue to remind, and that is that children who have SARS-CoV-2, who have COVID-19, can have residual symptoms, and at least up to 6% of children in one study have been shown to have long COVID. We absolutely must not discount the effects of this on children, in addition to being aware that we do have limited pediatric beds and pediatric ICU capability in the state of Alabama. Thank you.
Thank you. Okay. Anybody else?
Dr. Harris, when it comes to the Delta variant, we know that it's more transmissible, but for a person that would contract the Delta variant, are the symptoms more aggressive?
It doesn't appear that it's causing worse disease. There has been one study from Scotland that looked at the severity of the disease that suggests it may be a little worse, but probably overall it's not. Most people don't think it is more severe. It's certainly not less severe. You know, our rates of death that we're beginning to see now are looking like they're going to be just like we've seen before. I think we had all thought that if we have a younger population that's mostly getting infected now instead of an older population, that we wouldn't see, that it might seem to be less deadly overall. I'm not confident of that at this point. It is interesting that there seem to be some different kind of clinical presentations, a lot more of the gastrointestinal effects that we saw early on with the original strains. We don't see so much with Delta. It is more upper respiratory type stuff. So it is subtly a little different clinically, but not clear that it's worse. Definitely not clear that it's not, however. So.
Dr. Harris, how worried are you when with school, we've talked about this before, but with school back in session, universities back in session, even though a lot of colleges are requiring masks, what's your biggest fear in, say, the next 30 days as cases could pop up and we see the lagging effects of that, especially among, say, 20s and younger?
Yeah, I think the biggest concern is that we're going to continue to have increases in our case numbers, and a certain percentage of those people are always going to end up in the hospital, and a certain percentage of those people are not going to survive. So just the sheer numbers are going to lead to more people being sick and more people dying. But this is an incredibly taxing event for our healthcare system. You know, we have, you know, requests to come through the Alabama Incident Management System all day long from hospitals. Those are going up like crazy, and they're not necessarily COVID related. They're places that don't have a location to put a trauma patient. They don't have a location to put a patient who suffered a heart attack. These are very taxing on our medical systems, and so young, healthy people who may not be worried about COVID may have to have their appendix out, or they may be involved in an automobile accident, and it's going to be really difficult to figure out how that care is going to be delivered. Now, our hospitals have done a great job of doing that so far. They went through January and somehow managed to get through that, but clearly it's just not something you can do forever.
One of the largest groups
Dr. Harris,
that's hesitant
multiple
about,
hospitals.
go ahead.
I'm sorry, let me go to the phone and then we'll come back to the room. Go ahead.
Thanks. Multiple hospitals around the state, have mentioned in recent days that they're actually working with less staff than they had during the winter surge due to staff attrition, multiple reasons. We're seeing in Louisiana and Mississippi right now requests for federal aid to staff to help staff hospitals. Do you think that request might be likely from anywhere in Alabama in the next couple of weeks, or is that something that y'all have already requested?
Yeah, so we have not made a formal request. We have had multiple calls, and actually yesterday had a long visit with federal officials about the possibility of doing that. We're still working to figure out how those folks would be plugged in, how we would make a decision about where to use them. They come as sort of teams that are intact teams, and they're not just individual people you send here and there. So we're trying to figure out how that would work, but I do think that's a real possibility for us. Yeah.
One of the largest groups of the
Let me go to the room here, and then I'll go back to the phone. Okay.
one of the largest groups that still not be vaccinated are those healthcare workers that are working in the hospitals, and some hospitals are talking about mandates to do that. What's the issue there? What do you feel like that is the issue there, and why hesitancy in hospitals?
Yeah, I think overall our healthcare workers are not nearly as vaccinated as we would like, and yet they're a lot more highly vaccinated than the average Alabama population. And I do think it also kind of depends on, which hospital staff in particular you're talking about. I think our, critical care physicians and our ICU nurses, I think those folks are vaccinated in really high numbers. And, when you get to other jobs that are maybe less clinical jobs or maybe not directly dealing with that, the numbers are lower. Certainly our nursing homes, have done a great job of vaccinating residents, probably have not been able to reach their staff quite as easily. So, again, I think it just takes education, in terms of, mandating or not. My understanding as a non-legal person is that that's allowed in Alabama, that employers are able to do that. At least some employers are able to mandate that. But we wish, mandates weren't necessary. We wish people would just get vaccinated. Yeah, and we'll go to the phone now.
Dr. Harris, this is a question for our viewers.
Overwhelmed due to the high number of calls and need help from the state. They're hoping for a disaster declaration. Is that in the works?
Is that, I'm sorry, what was the last sentence? Is that
being discussed?
in the works? Yeah. Yeah, I would say absolutely. I mean, ultimately, that's a decision that the governor, will have to make. We certainly are trying to provide all the available information on that. There, if a, disaster declaration is coming, there, certainly needs to be really clear benefits from doing that and reasons to do that. We're working through ourselves the ways in which that could be beneficial. I know the healthcare institutions, some of them have written maybe made request about that. I'm not sure about the status of those things, but at this point, we're still trying to work within the framework that we have now, and then we'll have to figure out what a disaster declaration could add.
I have a question, Dr. Harris.
Yeah.
You talked about the coronavirus vaccines being free, but with the resurgence of cases, what about testing? Are people still able to get free testing at some of these locations around the state?
Yeah, so testing is, by and large free, at least in many locations, I guess, depending on where you go. But county health departments have reworked their staff to come up with routine testing teams as well. Many of our testing teams have shifted to vaccination efforts, but we have gone back to make sure that we have adequate testing as well. We have worked with I think that we may have closed the contract yesterday or maybe it'll be today, but we're working with a private provider who's going to do testing that we're going to set up in Mobile County, in Baldwin County, and then perhaps soon in Mobile County as well, that will just do testing as a way to try to take the burden off the healthcare facilities down there so that people aren't going to the emergency room. That'll be at no charge to people as well. So most testing is done free, although that may not be true, depending on which provider you go to, but certainly it is for us in public health.
Dr. Harris, this is a question we got from one of our viewers. How can they find out the number of new COVID patients in hospitals that normally wear masks and the number who do not wear masks on a regular basis, and how many of these are children of school age?
Alan, I don't think there's any way to know that. Usually those, I don't know about what that question is really getting at, but usually there are people who, want us to prove mathematically that masks are preventing cases. I don't think there's any way to consistently know exactly who wears what for how long and come up with an answer on that. We are getting pediatric information on hospitalizations. We can certainly tell you the numbers, but we don't have the ability to link an individual case to who's wearing a mask or, who in their home is or isn't or where else they've been. I don't know of a way to do that. The recommendation on mask is a consensus recommendation from the people who study respiratory diseases and the people who understand how these types of things are transmitted. We're never going to be in a position where you can go do a case control study and give half the people masks and refuse to let the other half the people wear a mask and see who gets infected. I mean, that you can't do human experimentation like that. Ultimately, the people who know the most about viral diseases and how they're transmitted say this is a reasonable way to prevent people from getting infected, and I agree with that wholeheartedly. Yeah, we'll go ahead.
My question, dealing with schools, Birmingham started a week or so ago. 31 kids, we understand, have come down with COVID, 3 staff members. Are you seeing now that infection rate going up right now because schools returning?
I would say that makes sense, although I can't say that for certain. I don't have the full breadth of the data to say that. The schools are going to be reporting to us again, just like they did last year, the cases that occur in their district. That'll be part of the school dashboard that, it's still on our dashboard, although it hasn't been active since the end of the school session in the spring. But we'll have that up in the next 2 or 3 weeks, or it may get pushed a little bit longer. It may be into September, but we're going to have that up again as soon as we're able to get the schools back up and running and in session, and then they're able to report that data, and then we'll get it displayed for the public. But I think we'll be able to answer that question once we start getting better reports to it. So, yeah.
Dr. Harris, health officials in Mobile County say that we are in a crisis mode. Some critical patients are being flown out of state because we don't have enough beds. Can you talk about how serious this is?
Yeah, I agree. It's incredibly serious. We are seeing, many requests from hospitals to transport patients who have nothing to do with COVID just because there's just no capacity. We know that, a number of facilities have reached out to us about certain types of waivers of rules that allow them to, put patients in other parts of the building and places they wouldn't normally provide, medical care, and there's a mechanism in place so they can do those sorts of things. But clearly we're going to be taxing our, hospital capacity in a way that we haven't seen before. I think we're very likely to pass our maximum number of hospitalized patients in the next 3 or 4 days, certainly if the numbers keep going like they are. Go ahead.
As you said, our numbers are approaching where we were in January, but at that time we had state mitigation orders in place, mask closures, et cetera, which no one liked. Without those in place, is it possible that this wave is going to be worse in numbers than hospitalizations?
Yeah, I don't know if it's going to be worse. It looks like the numbers are on a trajectory to be higher. I think we feel better about the fact that, our most vulnerable people are mostly vaccinated, and that really helps a lot. It means they're much less likely to get sick or to end up in the hospital. Our hospitals, as taxed as they have been, again, have had a few more months to get better experience at treating the disease, but also to, make sure their logistics are in place and all their material is stocked the way they want to do it. So there's some things that make the situation a lot different now. But, the other factor is we have a much more transmissible variant. I mean, it's much easier to spread. So I would, I don't know what's going to be worse or better or whatever, but we're going to have a few more tough weeks.
Dr. Harris, this far into the pandemic, what do we know about the best treatments for people that test positive, go home in quarantine? What do they need to do to keep from getting so sick they have to go to the hospital? What are the best treatments?
They need to get monoclonal antibodies in most cases. So monoclonal antibodies are infusions that have been available now for almost a year. There are different brands of them. There are a couple that have been we paused using because of concerns about resistance of the variants, but we also have other ones, new ones now that are available as well. They're widely available in dozens of places across the state. They're mostly given as an IV infusion, although there's some situations in which you can give them as a injection under the skin, a subcutaneous injection. They are, in most cases, for people who are at high risk for getting really sick. So people who are older, people that have chronic health problems, people who are not yet in the hospital. They're not for use for people who are already in the hospital. And you need to use them as early as you can. We try to make sure we get people to an infusion center within 10 days of developing symptoms, but the earlier the better. And sometimes it takes a day or two for a sick person to go get a test and then get their result, and then we have to find an infusion center for them, and that might take a couple of days. So it's not infrequent that we're bumping up against that 10-day window, but that is the answer. That's what people need to do.
One more final question from me, Dr. Harris. President and CEO of Infirmary Health this morning in a press conference said that we can expect the FDA to fully approve the vaccine within the next couple of weeks. Have you heard that?
I think I've heard the same media reports that person was referring to. I didn't hear that statement in Mobile, but yeah, we have heard that. Just in the national media, I don't have any inside information beyond the stories I've heard in the national media. We do know that CDC is releasing recommendations now about booster doses for immunocompromised people. We can talk more about that as well. But in terms of full FDA approval, I think we feel like the next 2 or 3 weeks we'll know the timetable for Pfizer. It'll be just for the Pfizer product. The others are a little bit behind the timetable there. Yeah.
Is the dashboard giving cases in schools, is that going to be updated, and if so, when and how often?
Yeah, that's what I was referring to earlier. So it is going to be updated. That, if you remember, just relies on voluntary reporting by schools themselves, and so we have asked them to start giving us that information again. They're very willing to do that, but schools, of course, are just now starting. And so it's going to be at least 2 or 3 weeks, or maybe into September sometime before we're going to have that up and running. But yes, it'll be the same dashboard that we had last year that has been paused really since the end of the semester last year.
Dr. Harris, you mentioned about the booster shot. Are people in Alabama trying to get that booster shot now? Has any gotten it hook or crook, and do you see the benefit of that?
Yeah, I don't actually know if anybody's gotten it. You know, we're not exactly policing it. Our recommendation, we have not made a recommendation for people to do that yet because we've been waiting on guidance on that. So it wouldn't surprise me if, you know, somebody hadn't managed to get that. You know, we certainly have adequate supply. I don't think it's a issue of fairness anymore. It's not like there's not enough to go around. We certainly have plenty to go around, but really our recommendations are based on what we get from national public health authorities and also from the FDA. You know, it's not appropriate for us to make an off-label recommendation on an emergency authorized product without, you know, the proper guidance to support that. So as soon as we get guidance on that, we're gonna release that ourselves.
Dr. Harris, you may have touched on this, but any update on the number of vaccinated people that are hospitalized, or the percentage of the hospitalized patients that are vaccinated?
Yes, I do have that. Let's see. So we are working with the Alabama Hospital Association to collect that information. We have been getting about I think we've been getting it regularly for about 5 days now, and so we'll start sort of prominently displaying that information as soon as we're confident in what we're collecting. But for the past 5 days, about 88 to 89% of people have been people who aren't fully vaccinated. So around 11% on a couple of days, 12% of people who were fully vaccinated have been hospitalized. So that's pretty much in keeping with what we would see. You know, we're actually past 1.6 million people who are fully vaccinated now, more than 2.1 million people who are at least partially vaccinated. So that's pretty consistent with what we would expect. The vaccines significantly reduce your risk of being hospitalized and almost totally eliminate your risk of dying, and so we need people to be vaccinated.
Dr. Harris, do you expect that we're going to go over 3,000 in the next 4 to 5 days? That was basically called a crisis situation last year. Is the entire state, every hospital in Alabama is going to be in a crisis situation as soon as next week? And how bad does it go, 4,000 or 5,000 patients?
Yeah, I don't know, of course, but certainly the trends right now are not very encouraging. The numbers are still continuing to accelerate. If you just map out the slope of the line, we will be at 3,000 people in the next, 4 days or so. I hope that doesn't happen, but it certainly may. Again, like we mentioned earlier, there's some ways in which we're in a better situation now than we were in January. But there still is also, some absolute number, I don't know what it is, that we just, can't go beyond because we just logistically can't handle it. So I think the message we want people to take away is that most of these hospitalizations, 90% of them are preventable. Please go get vaccinated as soon as you can so that you don't end up like one of these unfortunate folks who's had to be hospitalized or worse. Yeah. Oh, sorry.
Just taking 1 minute just to clarify, that 88 to 89%, are we talking about people who are fully vaccinated or have at least 1 shot?
So let me give you, so the number, so I have it on my phone. I'm sorry, I'm pulling my phone out here. Let's see. Over the past few days, this is on average over about 5 days, about 11% are people who are fully vaccinated, about 3% are partially vaccinated, and about 86% are completely unvaccinated. Okay. Anybody have any other questions?
Dr. Harris, that number that you said earlier, the 0.001% of, is that people that are vaccinated, like all the people that are vaccinated that have died from COVID, or is this people that are vaccinated and have had COVID, have had positive cases that are dying from COVID?
So that number, what we're calculating is we went back to April just because that's when we had vaccines more or less widely available, and obviously it didn't make sense to go back to a year and a half ago and talk about vaccinated versus unvaccinated. So going back to April, we've had a total of 23 deaths that have occurred in breakthrough people who are breakthroughs, and the denominator is just the number of people who've been fully vaccinated since that time. And I didn't write down what the denominator was, but it's 0.001% of the people who've been fully vaccinated since then who have died, and that number is is a tiny number.
And one more question. I know that there have been, there are now COVID tests on the market at local pharmacies, Walgreens, and CVS. Do you recommend people getting those tests that maybe don't have time to go to the doctor that think they might have it?
Sure, absolutely. I mean, if you're not able to get tested in any other way, we certainly would recommend that. We still hope people are interacting with the healthcare system. Those home tests are things we don't have visibility on. We don't necessarily know if people test positive, and as long as people have good medical advice and know what to do, I guess that's okay. But obviously, we like to be able to track the number of people who are infected if we can. And again, if you have a physician or other healthcare provider you're working with, you can get advice on what to do if you turn positive. Where do you get monoclonal antibodies, or what other care might you need? So I certainly wouldn't discourage people from doing those. It's probably better if you interact with your healthcare provider to get tested, but if this is the best way you have to do it, then certainly that's good too. Okay.
Dr. Harris.
Yeah.
You spoke earlier about the importance of making sure that people hold on to their vaccination records, their card, or to replace it if they were to misplace it or lose it. Why is it so important that folks hold on to these?
Well, there's a whole lot of, there's a big national debate, or international for that matter, about, health records that, the government mandates that people use or enroll in or carry or so on. And, we're not going to settle that in this room, but by and large, these cards are, sort of in different systems from state to state, depending on what the immunization information system is for a given state. And, we report these numbers to the feds, but they don't have a database that would really allow them to track it in the way that, you might, somebody tracks your income tax. So it's a fragmented system. It is mostly a paper system. Most people don't have the ability to get electronic copies of their results in most cases. And so it's just, it's a challenge to keep up with a piece of paper. If you have to keep up with your Social Security card, or even keeping up with your driver's license, you just have to keep those things safe, because it's not that they're irreplaceable, but it's problematic to get them replaced when you're talking about a physical document. So we do want people to try to hang on to those. Make a copy, keep it somewhere safe. Some people ask about laminating them. I would just say, if you want to, but there may be booster doses coming for some people, and you want to still be able to add that to your card if you can. So maybe think about laminating your copy instead of your actual card. And if you do lose your card, please reach out to your provider to start working on getting a replacement.
Dr. Harris, have the guidelines for getting tested changed since the Delta variant, since there are so many people who have been vaccinated and don't show as serious symptoms?
Just a little bit. By and large, they have not changed, except that even though we don't classify a close contact as in someone who's been vaccinated, if you're exposed to a case and you're vaccinated, we don't consider you to be a close contact. But we do recommend that you get tested about 4 or 5 days later, just in case you could have become infected. vaccinated people, don't have a serious disease, so they may not really come to medical attention. They may not feel sick, and yet there's still the possibility that they could get infected. I would tell you that, we know about, a few thousand, I mentioned breakthrough cases so far. We've actually fully vaccinated 1.6 million people. So just statistically speaking, there could easily be 300,000 breakthrough cases out there, and we've not even, we don't even know about a fraction of that. So it's certainly possible that if you're fully vaccinated, you could be asymptomatic but still infected. All right. Any more questions? All right. Well, thank you guys for your time. We'll be glad to do this as long as you guys find it helpful, and we'll talk to you soon.